Hey guys, Dr. Ruth Roberts here, the creator of the original Crock-Pot Diet, coming to you live from a hotel room in Reston, Virginia. I'm up in the at the Amen Clinic getting my brain scanned. As many of you know, I had to retire from practice because of cognitive defects from the dizziness I was experiencing. So I'm here trying to see if they've got some other options, since conventional medicine basically said, all right, you're as good as it's going to get. So that's swell. I'm better than I was, but not where I'd like to be. So it's interesting. If you don't know about the Amen Clinic, Dr. Amen is a psychiatrist, and many years ago he started doing SPECT scans, which actually look at the brain in terms of what blood flow it's receiving. And so they're able to help kind of target not only treatment with prescription drugs, but also with supplements, different types of brain boosting activities and diet. So right up my alley. So today I've got several questions. One is from Deborah, who was asking about why Westies get brown feet. And little white dogs, Westies, if you are not familiar with them, are look similar to Scotties, except for they're white, not black. So, and they do unfortunately tend to have a fair number of allergy issues. So brown feet can be an indication that the dog has been licking. In saliva and in the tears, there's a material called porphyrin, which is a breakdown material from hemoglobin, and that's actually what helps carry oxygen around your body, so that, and your dog as well, so that your tissues are doing well. And when those breakdown products, they end up in the saliva, in the tears, things of that nature. So little Chihuahuas and other Papillons, Bichons, any of the dogs with mostly white faces, you'll often see tear staining coming down. The other thing you'll see is staining of the feet. And so that porphyrin seems to increase when things are out of balance, and when they're licking their feet quite a bit, regardless of whether things are in balance or not, you're going to see that staining happen. So most of the time we say, oh, he's allergic, and often that is true, but that generally means that all 4 feet are going to have some staining. In dogs that maybe just have the front feet that are stained, often that matches up more with anxiety. So kind of think about that, Deborah, and see what's going on with your pup. If you feel that it's more related to allergies, if it's seasonal, then you could try something symptomatic like quercetin and nettles. If it's year-round, then that's when you really need to start looking at both environmental things like molds and pollens and things of that nature. Dust mites is another one that's a huge issue and can affect dogs year-round. And then so check that part out, and then also look at if your dog has leaky gut syndrome and everything it's eating on a constant basis is creating an issue. And Sally's asking, hey Sally, good to see you. Happy anniversary too. Glad you guys had a good time. If your dog's put on vitamin C for crystals in the urine, does she need to stay on it forever? And after retesting, after being off the vitamin C, and I can't read the last part of it, and the answer is maybe. So we're using vitamin C, which is ascorbic acid in many cases, to acidify the urine to prevent crystal formation. If you're feeding the Crock-Pot Diet, it's very high in vegetables, and so that does tend to alkalinize the urine. And we use vitamin C to acidify it to bring it back into what's considered a normal range. And that urine pH should be somewhere in the neighborhood of 7 to 7.5. So sometimes they do need to stay on it long term, particularly if you're feeding a home cooked diet, or it's just your dog's physiology. The upside is it's not there's vitamin C is a good thing. And in fact, interestingly enough, there was a study on the human side using intravenous vitamin C, which was scoffed at for decades. Linus Pauling got just ridiculed for suggesting that it had any ability to cure infection, but it was so the vitamin C intravenously was being used to help cure a very resistant infection along with some other antibiotics and conventional meds. And yes, checking pH can indicate improvement. So what I will often recommend doing is you can buy pH strips, probably on Amazon, because of this craze of alkalinizing yourself to prevent cancer. And check the urine every week or so to make sure that you've gotten the urine pH in the right range, and then check it once a month just to make sure where it goes. Sometimes over time we'll see dogs that they end up actually too acidic, and so then we have to decrease the vitamin C dose. But that's a way you can check it at home without having to drag your dog's urine or your dog into the vet to get it rechecked. The easiest way to catch urine is with male dogs using a ladle. So take them out on a leash, and they're far more cooperative about this than females are. And then with the female dogs, either the ladle trick if they're larger dogs, or a cookie sheet that you can kind of slide under her bottom as she's urinating. So I hope that helps, and that's how you can kind of continue to monitor it at home. Similarly, Michelle's writing in about her 13-year-old giant schnauzer. And during a yearly checkup, the phosphorus was 2.9, sodium was 148, BUN was 19, creatinine was 1.6, urine-specific gravity was 1020, and the urine pH was 8, and trace amount of protein. So here's what I'd say to that. The only number that's really out of range is the creatinine is very slightly elevated. Your dog is 13 years old. This is, again, when most veterinarians want to put your dog on a low-protein diet, and that's just crazy. This dog is 13. You go on a low-protein diet, it's going to lose muscle, and then you tend to have signs of arthritis show up. The other thing they'll say is, well, the urine-specific gravity is really low, and that's true. But in this instance, Michelle is already feeding a home-cooked food, so this dog is getting so much more moisture that it can actually use. And we see urine-specific gravities in the range of 10, 15, 10, 12, even up to 10, 20 when dogs are eating the crock-pot diet. So to me, this is really pretty normal. The microalbumin, I can't get it. The protein in the urine, we'll just go with that. Yes, it's there. And yes, your dog is eating a higher protein diet. Protein in the urine also is present when there's any type of inflammation present. And so this is part of why they developed the SDMA test, which has its own set of drawbacks. So, frankly, I wouldn't change anything here. She is feeding a kibble protein part, but then making veggies up. And so, what I'd suggest there is actually going with full cooked food, and I think that is going to really make a huge change. She's also doing a great job with supplements and things of that nature, as far as fish oil or krill oil rather, and using treats that are reasonable for him. So little pieces of animal parts and things of that nature. And the other thing she goes on to say is that so many of her clients are home cooking, but then she feels like they end up hurting their dogs because they're giving them commercial treats, which is kind of like, well, it is what it is. So the upside is that they're home cooking, and so hopefully 80 to 90% of their food is outstanding, and 10% is junk food. You got to live a little every once in a while. So if that's what makes the dog happy, super. But there's great ways to do dehydrated treats. There's commercial treats that are just pure protein or vegetables and things of that nature. And Michelle, yeah, please share the diet with them. But this would be my approach. I would monitor those kidney values to make sure that something isn't there. I would also consider getting a urine culture and sensitivity done if this is a new change in the creatinine, just to make sure there's not a chronic urinary tract infection present that's causing some of these changes. Again, as I said, the most common cause of protein in the urine is chronic inflammation, not so much that the kidneys aren't working. So urinary tract infection, bladder infection, will certainly do that. So I hope that helps you and your old guy. I mean, 13 is amazing for a giant schnauzer. If you haven't seen these guys before, if you know what the little schnauzers look like, they are awesome. But these guys are like very serious war dogs, and they were. So they're 80-pound dogs, very tall at the shoulders, very serious. And hey, Vicki, good to see you. And Aaron's asking what I know or think about stem cell injections for osteoarthritis, and I think they're awesome. We have seen that be just phenomenal as far as pain relief and things of that nature. And then I've also done a study on using stem cell therapy for kidney disease. And again, the results there were stunning. So my very dear friend Penelope's cat Sabrina is now 20, and she had stem cell therapy at 15, I believe. She had gone to the emergency room with just an overt kidney failure. Things improved somewhat at the clinic and got her well enough to get home. They implemented the Crock-Pot diet as well as several other supplements, and then we ended up using stem cells to treat her kidneys, and that's done by intravenous injections and then injections at the kidney. Her kidney values have not budged significantly in that period of time. The other really cool thing is that she fell and broke her hip. She had horrible arthritis, and literally the femoral head, so if you think about the hip, the ball and socket joint, the femoral head broke off because the arthritis was so severe. So the slick thing is that we were able to get cryopreserved doses of stem cell, or a preserved dose of stem cells, and inject that hip, and bam, in 3 weeks she was moving and grooving again. And it's been phenomenal. Her pain level dropped dramatically, and it was just awesome. So Aaron, I think it's a great idea. We've also used just plain PRP injections, especially for cruciate ruptures that are not complete. But I've seen the injections in the hips and elbows be phenomenal. So one of my other patients, Gator, at 4 or 6, somewhere in that neighborhood, had such horrible osteoarthritis because he was a Labrador that just won the jackpot on bad joints, and so he had arthritis in his elbows, his wrists, his shoulders, his hips, his hocks. I mean, poor dude. He'd already been on Deramax for a number of years. We did stem cell injection in every joint I could find, and the awesome thing for Gator is that in 6 weeks, he kept improving steadily, but in 6 weeks, he went to the groomer to get cleaned up, and for the first time in his life was able to stand up, put his paws on the counter to get a treat. And he stayed comfortable to the end of his days. He lived to be 12. So I can't recommend it highly enough. There's 2 options available. One is Medivet, which I had used in the past, and then the other, which I think if I were still in practice I would pursue today, is through companion regenerative medicine. A colleague of mine, Dr. Joyce Girardi, uses it and has been tremendously impressed. It is actually a bone marrow aspirate, so it's not, the upside is that it doesn't require general anesthesia, the processing is much less difficult, and you're still getting those stem cells delivered that same day. So Google her. She's up in North Carolina, but she's been doing a lot of work with regenerative medicine and has just done a fabulous job. So I think that's awesome. I had another question from Tara about she's having a hard time finding the ingredients in the cat multivitamin, and she wants to know the exact ingredients, including any fillers. So if you go to our website, theoriginalcrockpotdiet.com, and click on or enter in holistic total body support in the search, it'll pop up both dog sizes and the cat size. If you click on whatever size you're interested in, there's a label that details out the ingredients. And she's particularly concerned about fillers because if you look at vitamins for dogs, there are just scary stuff in there, like maltodextrin and gums and all this junk. So what I chose to use was alfalfa, because it does have health providing benefits in and of itself, and generally it doesn't create any reactions. Both the vitamins do have a glandular component as well, and so the sources are mostly pork, but there is some beef, and generally we do not have issues as far as reactions, because they are glands and different from muscle meat, but you can find the ingredients there. And Aaron's asking if there's anyone near Los Angeles for stem cells. I'm sure there is. Again, if you go to MediVet America, their website, they've got a practitioner lookup, and I'm sure that Companion Regenerative Medicine does as well. So that's what I'd go check out. What else can you guys think of? You got any other questions that are kind of rolling around in there? So a couple of other comments on the brown feet on Westies. So Deborah was asking about, why Westies have brown feet, and we talked about, I talked about that, often it's either related to allergies or to anxiety in some cases. So if it's all 4 feet, most often it's allergies. If it's the front feet, more often it's just anxiety. And this is something that I noticed in practice that's really been kind of interesting. So if you think about antihistamines and their chemical structure, it's actually they're very closely related in structure to tricyclic antidepressants. So things like clomipramine, which we used for decades for anxiety because it was inexpensive and it worked, and then the price went from $30 a month to $300, like many other generic drugs. So that started me thinking, and I had a client come in with this little Maltese that just itched and itched and itched and tore herself up, and he'd been through this vet and that vet and the dermatologist, and just got her comfortable but not great. And so we were talking, and in the exam room she's pacing around and anxious and itching and scratching and all this stuff, and he picks her up, puts her in his lap, and she stops scratching. So I'm thinking, what the heck is that? So histamine, which is the thing that makes you itch, activates a lot of other receptors, and potentially neuroreceptors as well. Or maybe it's just that her brain chemistry is such that it potentiates the release of more histamine and makes her itch more. Or perhaps it's, I don't know, some mechanism we really haven't understood as yet. So the cool thing was, for that dog, we gave him an Adaptil collar. If you're not familiar with that, it's a pheromone that the mothers release when puppies are nursing, so it helps calm them down. They've got it in a collar that uses the body heat to release the pheromone up around the dog's head and face, so they've got their little happy bubble wherever they go. You can get diffusers, there's a spray, all of this stuff. The awesome thing was, he put the collar on the dog, and her allergy symptoms practically went away. So we got down to the point where just bathing her, using different types of cream rinses, vinegar, sponge-on rinses, that sort of stuff, kept all of her symptoms under control. She was able to get off of steroids. She, rarely needed antihistamines. It was, shocking, really shocking. I never, and I'm 20 some odd years into practice when I finally figured this out. So I find that fascinating. And the more I think about it, the more I think that for her, because she'd had so many antibiotics and steroids and all this medicine, that her gut microbiome was just screwed, if you will. And so as she started to eat crock-pot diet and take probiotics and fish oil and continue to wear this collar, everything got so much better for her, and we were able to wean down off of so much medication. I've had other clients that were able to use, that had itchy dogs, that were able to use just probiotics, and like 90% decrease in symptomatology. So, because we tend to think in terms of organ-based disease all of the time, it's the skin and it has no relation to anything else in the body, we often miss these interrelations and the ability to improve one system and have it make an enormous impact on the rest of the symptoms. So, for instance, as I mentioned a few weeks ago, I've been dealing with SIBO, which is small intestinal bacterial overgrowth. And I got to tell you, it's not fun, and I got the extra deluxe case that nobody was able to figure out. So finally got enough clarity, strangely, on after my appendicitis surgery while I was still taking some narcotic pain meds. Don't ask me why that gave me clarity, but it did. What it did, what I was able to find was something called a Bi-Phasic diet, where you really take away all of the fermentable fibers. So you'll hear people talk about FODMAPs, and you've probably read about that to some degree. And they are fermentable oligosaccharides. I haven't had coffee this morning yet, which is why I'm really struggling. I had to not have coffee before the second scan at the Amen Clinic. Oligo, mono, polysaccharides, and polyols, and also following a specific carbohydrate diet. And what that does is it takes away fermentable fibers so that the bacterial count in your small intestine, and you have a normal flora there. So again, it's something on the order of 10 to the 4, versus in the colon it's 10 to the 11 or 10 to the 13. In SIBO, that small intestinal bacterial count goes up to 10 to the 11 or 10 to 13. So whatever you eat, those bacteria are like, all right, and they get in there and start digesting those fibers and producing gas and all of that. And I got to tell you, it is miserable. So literally, after I would eat, these little bugs would have so much fun and produce so much gas. All of a sudden, I had a 39-inch waist, and normally mine's like 33 because I've picked up some weight. So this diet's been helpful. And the thing that's been interesting is the amount of mental clarity that has returned simply because my gut flora is returning to normal. And I'm also, not to be graphic, but this is part of the deal with SIBO often, I had horrible diarrhea where my entire guts would drop out 2 to 5 days a week. So the debilitation from losing all my electrolytes and fluid and all of that was just horrifying. So that's been fascinating. The other thing that's been fascinating too is that as the bacteria start to chill out and the population starts dying down, you can get what's called a die-off or Herx reaction, H-E-R-X. And that's not fun either. And so that's the weird stuff, is that I had skin stuff popping up on my chest, on the back of my neck, on my ears. I've never had that before. And that's what was going on. When I threw some activated charcoal into what I was in with each meal, I was able to reduce those symptoms tremendously. And after a week or so, that die-off reaction settled down. So just wanted to put that bug back in your ear that if it's in the skin, it doesn't necessarily mean that there's not a problem somewhere else, and most often that problem somewhere else is in the gut. So that's why it is so important to rotate foods, to pay attention to, is your dog vomiting once a month or once every couple of weeks, or having diarrhea once a month, once every couple of weeks? Unless they're eating garbage, that's really not normal. We can see dogs get norovirus, but that's going to be like a total clean out and not much fun. So that's what I know for this week. Got a couple of more minutes if you guys have any other questions. Always great talking with you, and hope you have a great rest of the week. So until next week, remember, your pet's best health starts in the bowl. Take good care.